Okay, so we're going to go ahead and do the arrangement for the posteriors. Move this away. As you know, the posteriors need what is called a compensating curve. Albeit it's on video, I can still teach you and you can still ask you questions, okay? It doesn't mean that we all should be very quiet. Then we should put background music as well, Beethoven or something like that. So, okay. So I'm going to place my posterior teeth. I've given you the sheets for the posterior teeth arrangement. Did you get that?
Yeah.
Yes, position. Okay. So, as before, we are going to remove the wax. We always like to cut it like a cake. Okay. Remove the wax. Remove from both sides. I like to use an instrument that's not too hot to remove the wax. Right. And soften my material. I have my set of upper and lower teeth. This of course is a, what set is this? Upper or lower?
Lower.
Are you all sure that's lower?
Upper.
See? Now there are going to be people who tell me that's not upper, not lower, it's something in between. It's the teeth we use in the freeway space. That is the way to know. Count the cusps if you don't know the shape. So now I have placed the upper left premolar into position. So obviously that is the lower. Okay. And as you can see, there is a space. So I need it to be compacting. Okay. Now the one we are going to use here, we are going to use the concept of allowing the palatal cusp of the premolar to touch and not the buccal cusp. Okay. So I'm just going to slightly raise off the buccal cusp, but before that I see a small space here. I want to seal up that position. Soft wax. Move the tooth into position. Okay, that's fine. Make sure that right now it is not touching. So I'm going to just push this. My palatal cusp needs to touch. Right now both my cusps are touching. So I'm going to move it a little more in. Check it again. Not yet. So the amount it should touch, it should be in, is just the tip of my carver. That's enough. Let me just reset that a little bit. Okay, so now I can see something. I can see that my record base is touching. My record base is touching, I think. So I'm going to have to trim my tooth if it's touching. Let me check again. Let me see again if it's worked out like this. Yes. Now you don't want it to be too much inclined like that, because from the front then it looks very odd. Okay? So you want it to be just in line, just in position like that. Use some soft wax. You should not trim